So guys, this is one important procedure called needle aspiration. So this is very helpful in the patient of tension pneumothorax, and the patient got tension pneumothorax. Only thing patient will present in severe breathlessness stage. In this condition, only thing to be do is needle aspiration. If you are outside the hospital, if you are in the bus stand or anywhere in the outside, so what you have to do is you have to take a needle and you have to remove the fluid. So it is done in patient of pneumothorax, that is tension pneumothorax. What is meant by tension pneumothorax? It is a collection of air in between the pleural spaces. Because of collection of air, there will be the mediastinal push and patient will develop severe dyspnea. So in this patient, what you have to do is, so this patient is not a dyspneic and anything, because this patient had a massive pleural effusion. So after pleural effusion, we have tapped. So after aspiration of the pleural effusion, so she got some mild tension pneumothorax features. So in X-ray shows of mild pneumothorax. So what you have to do is, we have to try whether this air is there or not. We have to take this bottle with this IV set. So we have to insert in this bottle. So if you have to insert here, if the air is there in between the pleural spaces, so there will be the bubbles here. So what you have to do, you have to push here, and you have to take select the spaces around. I will select around 4th to 5th intercostal space, and I will push now. So we have to try whether it is coming or not. See, you can see this. Yes, right. You can see the air bubbles. You can see this bubbles were coming. One of you come here. Hold here. You can see the bubbles, air bubbles in this water bottle. So this is called as pneumothorax, a procedure of removing the air from the lungs, from the pleural spaces. See how much air is coming. So this is one important procedure. So the amount of bubbles coming from this directly removes the air from that pleural spaces. So you can see this beautiful. So now air is coming still. So what is this procedure? So how it will work? So as the patient is having developed some pneumothorax, and actually this patient is quite normal, like she is not having tachypnea, dyspnea, anything. But in patient of any sudden pneumothorax, if the patient is having TB patient, if they are having cavity or bullae, if the bullae is suddenly broken or the cavity broken, they will form some pneumothorax. So patient will have severe breathlessness. So in this patient, this need to be put some ICD insertion may be required. So as a patient is outside the hospital, as the medical field doctors, we are outside the hospital. So what you have to do, in outside hospital, it is very difficult to put, and it is not possible to put ICD. So in this condition, what you have to do is, you have to put a needle. You have to take 18 gauge number needle, and we have to check from if you are not having strength, from clinically percussion you have to do. If it is an air, there will be the very resonant percussion, and we may be there. So by seeing resonant percussion, we have to prick this needle, and we can see this. If you have to take one bottle, so this is called a layman. You can do this procedure in anywhere. So this is very important. This is life-saving procedure. After you have to, this is not a final procedure, or it is not the final treatment. After doing, and the patient is comfortable, as the air is coming outside, patient become feeling better. So patient will feel comfortable, and the patient is comfortable. After that, we have to shift the patient to outside hospital for the ICD insertion. So this is the procedure. Thank you.